everyone, and welcome back to the Arthritis Broadcast Network's hashtags AC Arthritis. I'm Isabel Trisky. I'm with the Arthritis Consumer Experts, and I'm also with the Global RA Network. Today, first interview of the day, I'm thrilled to be joined by two doctors, Dr. Lisa Lix and Dr. Lily Lim. So Dr. Lisa Lix is a professor of biostatistics and Canada Research Chair at the University of Manitoba in Winnipeg. And Dr. Lily Lim is a pediatric rheumatologist, clinician scientist at the Children's Hospital Research Institute of Manitoba at the University of Manitoba in Winnipeg again. Thank you so much for being here. Yes. So a nice day ahead with lots of meetings, workshops, poster presentations, and I believe you are also presenting or participating in a workshop. So we'll talk about this in a second. First, I'd like for you to say a little bit about what you do and your involvement in rheumatology. So maybe we start with you, Dr. Lix.
Great, thanks very much. Well, my interest in rheumatic diseases stems from working for a number of years with clinicians and using large anonymized electronic health databases to study rheumatic diseases, including their burden in the population and health service use and health outcomes amongst individuals with rheumatic diseases.
Oh, interesting. And yourself?
So I'm a pediatric rheumatologist. I'm a doctor by day and also a clinician scientist. So that means that I do research. My focus is in pediatric rheumatology. And I've also started to work with Dr. Lix as well as my other collaborator on health administrative data. What it is a kind of healthcare big data, and we are using machine learning to try to get at the information in this big population data. And we did it recently using juvenile arthritis, but hope to be able to do it in other rheumatic diseases as well, especially in terms of earlier diagnosis, picking the patients up earlier in their journey.
So for children or the whole?
Currently in children, but also in the future in adults as well.
Okay. Wow, super interesting. So the workshop this afternoon that's named Artificial Intelligence in Practice, Pattern Mining of Healthcare Data for Complex Chronic Conditions. So can you tell us a bit about what patients should take away from what will be said this afternoon?
Well, first of all, I think one of the keys to take away is the use of innovative methodologies to try to, as Dr. Lim has said, understand the sequence of events, the patterns of use that emerge from mining large healthcare databases. And we can use those patterns to understand the diversity of patients who have rheumatic diseases, and also how we might use those to better understand the treatment trajectories and outcomes. Lily, do you want to add to that?
Yeah, I think from clinical practice and being in rheumatic diseases research for a while now with our patient partners, we know that it's a very long and complicated journey, and people have done studies and shown that the average rheumatic disease or rare disease patient can see up to 8 different specialists before they get a diagnosis. So in our work here, we actually demonstrate that machine learning can be used in a rare or uncommon disease like rheumatic diseases. In this case, we use juvenile arthritis. And the patterns that we discovered are very interesting, and they're occurring before even the confirmed diagnosis of rheumatic disease. So I think this has got great potential in shortening that journey.
And so between research and application, what's will there be a big gap? Or where are we at with this?
Well, as working with complex health data, certainly we've been focused on the methodology. So developing and refining the approach that we use, And that involves, as Dr. Lim has mentioned, an interdisciplinary team that includes those who have experience with the data, as well as with the artificial intelligence or data mining technology and methodology, and then looking at the so what, the how do we translate that knowledge, how do we interpret the findings that we have, and of course that's the clinical piece.
Yeah. So I think we are at an early stage yet, but with a interdisciplinary group like ours, where we can bring in all our different expertise so that what we find really have clinical meaning and hopefully will be translatable to the real world for our patients. Is there a gap between current and the future? Yes, because this is not easy work. I think that's why we need the expertise, right? A lot of thoughts needs to be going into the processes so that what we discover and what we find will make sense, will be applicable in the real world. Yeah, so there will be a gap, but we hope that we will bridge that gap.
Yeah, and so do you get? Do you feel that healthcare professionals are interested in those new methodology and AI and with these new technology to help them and their patients?
Yes, very much so. We know that data about patients is being generated at a phenomenal rate. So being able to sift and sort through that data to understand how it can inform treatment and improve outcomes certainly is of great interest to healthcare professionals, and also to students within our universities have a strong interest in bringing their skills to improve patient experiences and outcomes.
Yeah, I think that's definitely an interest. And this has potential to transform care for the future.
Sure.
But I think it needs to be thoughtfully adopted with safeguards in place for the best interest of the patients.
Yeah. We're talking a lot about AI and, lately ChatGPT is all over the place. And some people are kind of worried. So I understand that, patients may be worried about what their personal data and information.
Yes, but I think that's why it should be a thoughtful adoption. Of technology.
Oh, that's like it's super exciting. And so the theme of this year's meeting is reconnect, renew, and reimagine. So I guess we're more in the reimagine, renew concepts or areas. Yeah.
Certainly with these large electronic healthcare databases, reimagining new opportunities to use them to benefit our understanding of health of populations and also healthcare use is critically important, particularly at a time when we know that the healthcare system is challenged in many ways.
Yeah, so Lisa has a population level overview, whereas I would have the more clinical overview. I would say that reimagine a world where your physician will have the power of AI at their fingertips, right, helping to supplement their clinical expertise. So that would be bringing together the best of both worlds.
That's amazing. And are there any information about your program or your research that patients could go to?
I think we are.
Or any resources on AI, information on AI and healthcare, and are there any?
I think for our work, we are currently still in the early stages yet, so it's not out there in the public domain, although we'll be presenting some parts of it during our workshop, also at another talk at this meeting. But I think in time to come, as we get more information, we may be able to, we will definitely look to disseminate the information and share our information, our findings with patients.
Great. And so any other insights or, ideas or that you'd like to share with the viewers out there that would, contribute to improve the patient disease journey or, healthcare outcomes.
Sure. I would say that I think we are at the threshold of a very exciting future. Yes, there are concerns about privacy, and but I think we are in this together. We can harness technology if we put in thoughtful thoughts into how to adopt it in a way that will be beneficial, but of course without infringing on privacy. But there's a lot of power and information that we are all generating and putting into the electronic, I call it big clinical data space, that can be very helpful because this is way beyond what traditional medical research can do, right? Because a lot of times we'll have to the kinds of patients recruited into cohorts or drug trials may be very different from the kind of patients that we are seeing in clinic where they have multiple morbidities. Not so much in children, but definitely for my adult colleagues, they have 3 or 4 or 5 conditions on top of their rheumatic disease. But traditional studies or traditional drug trials are not going to be recruiting that kind of patients because it muddies the water, right? But with this real world perspective that we can glean from big clinical data, big health administrative data, I think we will have a clearer picture. And I hope that in the future, the decisions that we make will be more based on the real world evidence. There are a lot of initiatives now going on to at the regulatory, especially in Europe, authorities to try to put safeguards and also into the system adaptation of these big clinical data AI technology. I think this is definitely a space to watch. And I would say to our patients, we are doing our part, so empower it. Don't be scared of it, or else we will not be able to harness the potential power.
Truly, they have a big role to play there, definitely. Any questions from the viewers?
I think the doctors already covered it a little bit, but so the question was, how can researchers and healthcare professionals address privacy concerns in patients?
Great question. So in any of the research that we do, certainly we operate in a privacy conscious environment where there are safeguards around who can access and use these large healthcare databases for research. And certainly both provincial and federal privacy legislation, we operate very carefully under that legislation in any of the work that we do. And we are working at a level where we don't look at individual patient data, but rather are interested in the aggregate or groups of patients only.
And would the regulations for healthcare in terms of artificial intelligence be the same as it would be in the field of technology or in the field of media?
Well, certainly with electronic health data and applying AI technologies, there's always this concern about the black box environment, right? That we don't truly understand the kinds of methodologies that are being applied. Now, working in an interdisciplinary team, as Dr. Lim has identified, certainly important to ensure that we're representing the data well, and that we're using appropriate technologies applied to that, to ensure that there is an equity lens and that we're representing well all groups of patients that are found within the data.
Yeah, true. We were at ACE talking a lot about inequities in healthcare, and so I appreciate that.
And training the next generation to recognize that. I'm in fact part of a national training program around the use of artificial intelligence in the public health sphere, but certainly bumps up against. We have patient partners that are involved because it bumps up against that patient sphere. So our goal is to train early career researchers, and those who are just starting in this area to recognize the potential for inequities, and to identify methodologies and approaches and understand the data to ensure that those don't unduly influence the conclusions that we draw from the data.
Very good. Any other questions? No? Well, that was super exciting. I'm eager to see the future of your research. Thank you so much for being with us today. Good luck for the workshop. I hope it will be a very dynamic one. Thank you all for watching us.